Hi, it's Beth here from International RN, and today I'm going to talk about your neurological assessment for your OSCE exam. So this may occur as part of your assessment station. You may be presented with a neurological patient. The common diagnosis you will receive is subarachnoid hemorrhage. The patient may be presenting as confused. So we're going to go through how to conduct your neuro obs and also how to complete your chart. So you will not have the News 2 chart, you will have a neuro obs chart, which I'm going to show you and go through. It's recommended according to the marking criteria that you do your neuro assessment on part of your disability exam on your A2E assessment. So starting from the top of the chart, I would recommend you just work your way through the chart in order to make sure you filled out everything and you haven't missed something. It says to do your GCS. So as you knew, GCS for a normal patient should be 15 out of 15. For your confused patient, it might be 14. So first section is eye opening. So how do we check that in the exam? Well, normally we just walk into the room and the patient's awake and we just mark spontaneous. Exactly the same, but we just tell our examiner this. So examiner, when I entered the room, you're going to introduce yourself to the patient, aren't you? And I introduced myself, patient answered, so I'm going to mark spontaneous eye opening. Okay, next section, so that will be scoring 4. Next section is verbal response. So that is where we check if they're orientated or confused. So for doing this in the exam, we should do a 3-point check. Okay. So this means you have to ask the patient 3 questions, and if they answer correctly to all 3, you can mark them as orientated. If one is missing, then you mark them down as confused. So examples of questions we can ask is, do you know what day it is, what time it is, who's the king, do you know what my job is, that kind of thing. Let's say the patient answers all of them correctly, but he says he's in the supermarket. Okay, that patient you're going to mark as confused because he missed one of the 3 points. Okay, and you would mark them down as a 4. If they're orientated, you would put 5. Motor response, now this is when you ask them to do a simple task. So if you haven't asked them to do something already, like when you did the blood pressure, you probably asked them to put their arm out. You can just ask them to do something like stick their tongue out, raise their hand, and they will do it for you in the exam. So just put 6. We're not going to go in detail about like abnormal results and that kind of thing because you don't need to worry about that in the exam. They're not going to give you a really unwell patient. Okay, the next section on the chart is temperature. So if you haven't marked that already, if you just go ahead and chart that now, I would advise you to. And then you've got your normal vital signs, so blood pressure and heart rate. So I will show you an example of how to document this, but you just need to do your arrows for the blood pressure and then a dot for your heart rate. It's not like the News 2 where everything's in its own separate box. It is a bit messy, so just chart that there. And then respirations, you're going to write the number like 16 and the same with saturation, so 98, whatever you've got for that one. Okay, there isn't a space for oxygen. Like if the patient's on oxygen to mark that, but you shouldn't have that with your neuro patient in the exam. You will only have that if you have the respiratory patient or maybe the heart failure one. Next, we're going to do the pupil reaction. So this is the kind of torch we have in the UK. So to work it, you just press on the like clip thing here, and you're going to do your neuro assessment. So shining the light from the outside to the inside. On your torch, you've got the size of the pupils. It's also on the right hand side of the chart, and on the right hand side of the chart is some things to help you with documentation if you forget in the exam, because I know you're going to be stressed and you're not going to remember. There's just some prompts there to remind you. Okay, so signing from the inside, from the outside to the inside, and we'll remember we're watching for that pupil to restrict and expand. Okay, when you sign it into one eye, check that eye, and also let's say we also check the alternate eye. So you may need to do this twice, because when you sign it in one eye, the alternate eye should also be reacting. This is just demonstrating that the pathway in the brain where the eyes connect is still functioning. So check both eyes. Once you've done that, you need to document it. So size, you're going to write a number. So normal pupil size is going to be anything from 3 to 5. So whatever it is, just write it down. And then for reaction, you're going to put plus. Okay, next we're moving on to the limb movements. So you need to check both arms and legs. So ask the patient to stretch their arms out. Apply a bit of pressure with your hands on top of their hands. Ask them to push against you, and then the same underneath. If it's normal, you're just going to mark it as normal. And then with the legs, the same, one leg at a time. Ask them to raise their legs, push your hand against the top of their leg, and then place your hand under their ankle and ask them to push down on you. They should be both the same, but maybe you have some variations. So to document this, if both are the same, we're going to write R and L for left and right in the normal power box. Let's say we have like a stroke victim as a patient, for example, and they have a left-sided weakness. So in the normal power box, we're going to, for the arms, write R. Okay, so the right side is normal and the left side is weak. So on mild or severe weakness, whichever one you feel it is, you would put an L for left. So we don't put right and left together. If there's some weakness in one side, we need to separate the two into the correct box. The same with the legs. So marking them accordingly. I will show you an example of this. I know it's a bit confusing, but you should have normal power for everything. Okay. Next thing on your chart is total GCS score. So that will be 14. If patient's confused, if patient's orientated, it will be 15. And final box is initials. And at the end, as I would suggest you do with all of your charts, if you have time, just double check it. And if you have time left at the end of your station, go through and review any charts you've completed as part of that station. Okay, and good luck with your exam, guys.